We're gonna,
No.
yeah.
Broadcast is now starting. All attendees are in listen-only mode.
Good morning. My name is Melody Pazalt. I'm the supportive housing, I'm the Recovery Support Services Section Manager at the Healthcare Authority Division of Behavioral Health and Recovery. We'll get started in just a few minutes or two. I reverted back to my old days when I used to do a lot of webinars. So welcome. We'll get started in just another minute or two. So welcome everyone. This is Melody Pazalt with the Healthcare Authority and the Division of Behavioral Health and Recovery. I am joined by my team this morning, Nicole Mims, Amanda Poley, Kimberly Castle, we have Lisa Bennett Perry, Wanda Johns, who are all here today to support this idea that we have been in contact with you about blowing the lid off the eligibility for the emergency housing vouchers for crisis stabilization facilities. And so we wanted to present some information about how to connect people to housing. This will actually be a two-part webinar series. We are working on a second webinar coming soon around connecting individuals to ongoing mental health services post a discharge, focusing on how to leverage the hourly crisis stabilization service modality and facilitating those warm handoffs to outpatient service delivery agencies. So we're working on developing the content for that one, but we're very excited to focus today on sort of a kind of a housing 101 on what are some of the resources that are available to help individuals that may need housing supports that are in crisis stabilization facilities and stepping out and needing that ongoing, those ongoing housing resources. What programs are out there that we can get involved early in the process, and an overview of some of those different programs and resources, and then just some tips on facilitating those warm handoffs. And so let me have my team introduce themselves. Amanda, Kimberly, Lisa, Nicole, Wanda, I'll let each of you guys introduce yourselves, and that way it'll also be a sound check.
Thank you, Melody. Hi, my name is Kimberly Castle, and I am a supportive housing program manager for foundational community supports at DBHR. So my role is to provide all things technical assistance and training around supportive housing, and I serve Western Washington.
Hi there. My name is Amanda Poley. I'm a supportive housing program manager for foundational community supports and supportive housing. I serve Eastern Washington, and I'm so glad to be here with everybody.
This is Lisa Bennett Perry. I am the Support Employment Supportive Housing administrator. I oversee two programs that Melody will go into some detail for. That's PATH, Homeless Outreach Program, and our Peer Pathfinder Outreach Program.
And good morning, this is Nicole Mims. I am the Forensic Harps Program Manager, and I also oversee the contracts for the emergency housing vouchers at each of the crisis stabilization facilities. My work is part of the True Blood Settlement Agreement. Thank you all for being here this morning.
Good morning, this is Wanda Johns. I am the original HARPS program manager, and I appreciate you coming to this webinar.
Thanks, team. Next slide. So you all are here because we've been having some conversations with you about blowing the lid off. That's what we're affectionately calling it, blowing the lid off of the eligibility for the the emergency vouchers that are attached to crisis stabilization facilities as part of the True Blood Settlement Agreement. One of the things that we sort of recently discovered was just the interpretation of who's eligible for those emergency vouchers. And originally we had interpreted the language in the settlement agreement to be limited to individuals that had intersected with the criminal justice system in the last 2 years, or who were referred or dropped off or held at the crisis stabilization by law enforcement. And that population is still a very important population that we want to connect with the Forensic HARPS program, but there are a lot of other individuals that may benefit from those emergency vouchers. And so we wanted to have a conversation with you all about what does that look like for an individual that doesn't have that ongoing support through the Forensic HARPS program? What are the other programs that we can get that person connected to help with their housing stability? And so we, as well as their ongoing mental health support in post-discharge. And so the webinar today is going to be focusing really on those triangles: coordinated entry, foundational community supports, HARPS, PATH, Peer Pathfinder, and home and community services. So how can we get individuals better connected to those programs to help with the ongoing support to actually help individuals find, obtain, and maintain housing? And then the second webinar that we're planning is how to better connect those individuals that are going to be receiving those emergency vouchers with ongoing mental health supports, because we don't want to see the housing providers be that mental health support. We want them to focus on getting that person housing. And so it really is a two-prong approach to ensuring individuals stepping out of crisis stabilization facilities have both their mental health services as well as the housing supports necessary to help them be successful. Nicole is in the process of amending your contracts to add these additional funds to your contracts. And so we certainly know that there's a great need. We've had conversations with each of you, and you've all identified that the need is absolutely there. And so we want to make sure that we have some tools in your toolbox to be able to help while we expand the eligibility. And so we want to just kind of put some of these ideas out there and resources out there. We hope this is also a dialogue, because if there's things that you feel like you need to help individuals be successful, please let us know, because we're also interested in trying to help meet those needs. And so this is, I think one of the things that we talked about is, one, sharing information about these programs, but each of these program managers, Lisa, Wanda, Nicole, they're also talking to their providers and letting those providers know, hey, these resources, these referrals are going to come. So nothing is more frustrating than to send a referral to someone and them not receive that referral or step into then providing services once you've made the referral. So we want to make that connection between these programs, and we're working with these programs in those triangle boxes to make sure that the referrals are received as well. So that is an ongoing process, and we have some tips and strategies that we want to promote to help make that referral process more smooth. Next slide. So we wanted to just kind of, housing is really complicated, and that's really why we need specialists. That's why we need, there's so many different trickles of funding out there to pay for housing. And we also know that there's not a lot of bricks and mortar, actual housing stock. And so we really need to be able to have all three legs of the stool addressed. And so, helping individuals navigate all of these funding trickles, like housing and essential needs, like the Section 8 vouchers, like the non-elderly disabled vouchers, the tenant-based rental assistance program, the home funds. We just heard from Commerce that they have 2 new programs, the ERAP and TRAP. So there are funding streams out there to pay for rents, as well as pay arrears so that people don't become homeless. But you really need those housing specialists, those experts that are really adept at knowing all of these different trickles of funding. And that's really where the programs that we hope to share with you today can be those resources, those specialists to help people get connected. And, oh, you're good, next slide. The other part of housing specialists is really giving people choice and power and control over the type of housing. There are really a lot of different kinds of housing out there, whether it's that person's own home, whether it's shared housing, whether it's private market rent, whether it's affordable housing, whether it's adult family homes, whether it's assisted living facilities. There are so many different avenues, and it's really trying to, I think, do a paradigm shift around how we think about housing. Rather than any housing is good housing, but really what kind of environment does that person need to be successful? And so these housing programs that my team are going to go through today really talk about what does that housing look like for that person, and what do they need to be successful? What does that environment look like? And what are the funding streams or funding trickles to help them obtain that housing? And so that's really part of a paradigm shift in thinking about housing and developing that housing assessment and that housing plan. And so it really can be overwhelming to think about all of these different types of housing, and really that shift in thinking about rather than any housing is good housing, but really what kind of environment does that person need to be successful in. And so that's also part of what these programs do, is they help start moving us into that paradigm shift approach around housing assessments and housing plans. Next slide. I think this is another kind of way to think about that continuum of housing. Really trying to give people rights, privacy, dignity in the type of housing on that continuum, from really very restrictive settings to the most unrestricted setting, and giving people choice and power and control over their lives. And so, certainly people move back and forth on this continuum as well, but we really are also trying to expand the opportunities, and again, really trying to make that match between the housing environment that that person needs to be successful, and then following them along the process. Getting somebody into housing does not solve all of their problems. It's also those ongoing supports that we can provide through these supportive housing services to help them be successful. And people do move back and forth on this continuum, but it's really always trying to move towards those principles of people's rights, privacy, and dignity. Next slide. So I'm going to turn it over to Kimberly and Amanda to share more about supportive housing and more about these programs that we want to introduce you to today.
Thank you, Melody. So on this, we really want to talk about outcomes, and Washington State has been really focused on ensuring successful outcomes and for the individuals we serve across Washington State, and really making sure that folks are receiving good services. And so when we talk about outcomes, we were actually legislatively mandated in 2013 to use evidence-based practices or promising practices in our programs. And so one of the things that we have done is identified permanent supportive housing through SAMHSA as the evidence-based practice that we use here at Washington State. We do this through fidelity reviews, by teaching the principles to folks, and then really ensuring that folks are understanding and receiving really good services across Washington State and providing good services across Washington State. And we're going to go over those principles here in a few minutes. So I love sharing this slide. This is one of my favorites, and it's really because, you know, supportive housing is so important in our folks doing well in their physical and mental health, and it's a huge piece of our folks moving forward and being successful. And so one of the things that excites me is when I started housing back in 2011, we were just starting pilot programs similar to what foundational community supports is, and in working towards being able to actually give out almost the prescription for supportive housing, right? Now, we can't give out this prescription like this that says you're getting one studio apartment, please go get this taken care of and this will improve your health. But we're so much closer than we were. Right now with our foundational community supports benefit, we actually are paying for supportive housing services and supported employment services through Medicaid. So we're that much closer than even a decade ago from being able to provide these services through Medicaid and say, hey, this is the best medicine. You need a prescription for a house, and we can just hand that out. So I just love this this slide because it really shows how important housing is to the individuals we serve and them moving forward and improving their health and their well-being. And so we want to make sure that we continue to give them really good services and get those successful outcomes. So one of the parts of what we really talk about in Washington State is that housing first model. And I don't know if everyone's familiar with housing first, but housing first really is an approach to quickly and successfully connecting individuals and families experiencing homelessness to permanent supportive housing. And without any preconditions, without any readiness requirements, such as saying you have to be clean and sober to live here. You have to go through treatment, or you have to see your therapist once a week and prove to us that you're ready to be housed. Housing first means someone can come in and say, hey, I need housing and I'm ready. And that's when we start working with them and getting them moving forward. And then working on those challenges or those skill sets that they need while they're still getting housed, so that there is no precondition. If someone needs to be housed, we house them and start working with them to with whatever challenges or barriers they have, all the while still honoring their choice and housing them. So this is the principles of permanent supportive housing that I talked about with our evidence-based practice through SAMHSA. These are the principles that we talk about in all of our services. So these are really important to how people receive services, because we're really wanting to focus on making sure we do get those successful outcomes. So this evidence-based practice really is like a recipe, and I like to use the example of chocolate, that award-winning chocolate cake, where if you follow these principles, you're going to get that, or you're going to follow that recipe, you're going to get that perfect award-winning cake, right? And so this is our recipe for great outcomes in supportive housing. I'm not going to go into great detail on these, but I do want to go over each one just briefly. Choice of housing, you heard Melody talk about choice and how important that is. We really want to ensure that folks have a choice in where they get to live and who they get to live with. When choice gets taken away, you're taking someone's power away. And we know from evidence that, and from data over the years, that when people get to choose where they live, they actually are more successful and stay longer. So we want to really ensure that we're asking people not only what they need in housing, but what they want in housing. It's so important and makes a huge difference in their success. Separation of housing and services is really about ensuring that folks that are providing those supportive housing services do not have a housing management role, meaning they're not the same people collecting rent, doing evictions, those kinds of things, because we really want that separation so that it doesn't change the dynamics in that supportive services that we give folks. They don't want, it's hard to give someone the truth when they're also having the housing hanging over their head. So we want people to have that separation where there's support services, the support only, and then whoever's managing their house does that role and keeps those very separate. Decent, safe, and affordable housing is really about, well, it's got 3 prongs. So decent is really about that housing quality standard, those inspections to ensure places pass HQS. We want to talk with participants about what that looks like, what passes, what doesn't, and whether they care if they live in a place that passes inspection or not. That's, again, another choice, right? And so talking about where they're living and what that looks like. Safety is a separate thing. I know a lot of times we think about safety as in the physical parts of housing, but really this is about, like, do they feel safe where they live? It may be that we're trying to house them in an area where there is, drug use, a lot of drug use, and they're trying to stay sober, and so they don't want to be around that, or whatever the situation is. But we need to have that conversation with them and ask them, does this feel safe to you? Would you want to live here? And that affordability piece is, of course, keeping people in affordable housing, getting them connected to supported employment, ensuring that they can maintain housing long term. Integration is about getting people connected into their community and ensuring that we're looking at where people are living and integrating them so they have ways of connecting to the community that maybe they didn't have before. So getting someone into a scattered site housing out in the community where they're not maybe living with people that they've met before or get services with. And that allows them opportunity to meet someone that they haven't met before, maybe get a job opportunity, and really connect to those natural support systems in their life. Rights of tenancy, this is all about making sure our folks have legal rights to tenancy, that they're not asked to do anything that we wouldn't want to have asked of us when we're living in a place, looking at those leases, working with landlords to really advocate for that for our participants, and ensuring that they're not going into situations that they don't understand. Access to housing is that housing first piece. We really want to make sure everyone gets access to housing. And so not putting up additional barriers to our individuals to house them. So again, that housing first isn't just about that readiness requirement, but it's also about meeting people where they're at, right? And making sure that we're getting out there and getting everyone access to housing that wants it. And that flexibility and flexible and voluntary services, all about the services the folks receive. Individuals have choice in how they get their services, when they get their services, and ensuring that they have a piece in a say in all of what we do with them, right? That their voice is being heard throughout treatment planning and all of that. So this is our principles. We live by them here at Washington State. We know that they work. We've been using them for at least a decade. And so if you guys want a copy of this, we'll ensure everyone has it. I have it up at my desk all the time, so I can always be looking at them.
So hi, this is Amanda. Thanks, Kimberly and Melody. That was great. So I'm going to go ahead and talk to you a little bit about some of the services or some more that are available in Washington State around helping individuals who are experiencing homelessness. So I would like to talk to you a little bit about homeless outreach in Washington State. If you have an opportunity or you have the ability to, can you please type into the question/chat box? Do you know how many outreach teams there are in your service area? Or are you the only outreach team in your service area? We'd really like to know that. So, all right, so there's a little bit of activity in the chat box. Thank you very much. So a lot of the times there will be plenty of homeless outreach activity done in every area that we're in. We just may not be actually moving forward with it. Can you flip the slide forward, please? Sorry. We may not be actually realizing what's going on when we're doing the outreach. Sometimes it's easy peasy. We're driving down the street and we see somebody with a sign and we want to help out. And there are ways and programs that we have, PATH, the Projects and Assistance through from Transition Through Homelessness, And then also we have our forensic path, which I'll cover in a few minutes. The homeless outreach really is our foundational piece of getting out there and making sure that we have some kind of connection, not just in our community, but also to the to people who are experiencing homelessness and maybe don't know about services that are available. So, you know, outreach is all about going out and meeting people where they're at, going and beating the streets. If you live in a rural area, you might know of some camp areas where you take an additional staff with you. All of these things are really important to engage with individuals because they most certainly may not know about the services that are available to them, or they may think that they're not able to get them, or that they don't qualify. So since we're the experts, this is usually where we start. Kimberly, can you please move that forward for me? Thanks. So who doesn't love the pug-a-corn, right? So I mentioned a few minutes ago that this is, you know, outreach is all about meeting people where they're at, but it's not just meeting people physically where they're at, it's about meeting them where they're at in their recovery journey. So if somebody is just starting out or they're restarting again and maybe they're struggling with something that you don't understand completely, that's okay. That's what we're there for. You know, it's incredibly important to make sure that we build that trust up and that we show respect and acceptance with everybody that we come across in order to build that bridge and continue forward with services. Okay, so Sydney says she's never heard of PATH or Peer Pathfinder, and that is really exciting for me to talk to you about that. I'll get into a little bit more detail, Sydney, if you give me just a few minutes, but I will let you know that Peer Pathfinder and PATH are two outreach teams that specifically move around people experiencing opioid addiction, and then also people who are experiencing chronic homelessness as well. So there is a piece for specifically around substance use disorder with opiates, and then there's also another one just for people who may not be experiencing opiate struggles or challenges. So, okay. I'm gonna just push this little box back, sorry about that. So yes, meeting people where they're at. If you reach out with a participant and it turns into a situation where they feel like you're judging them because maybe they have very large cautious feelings, this could be a really large tool in your tool belt for that. Next, please. Oh, that's you, Kimberly.
All right, so I wanted to just talk a little bit about what coordinated entry is. Coordinated entry is a quick access point for folks to get connected to the most appropriate housing. And so there is standardized assessments and referral processes for coordinated entry that allow people to prioritize the individual to see where they fall into the priority scale. And every county, not every county, but counties across the state do have different assessments. So depending on the county, there may be a separate assessment or a different assessment they use, but all of them are there to prioritize individuals to see where they fit in what housing they're eligible for. This is really important for two pieces for housing. One is that, you know, it's the first step in getting people connected to at least some housing programs that are available across the state. A lot of these housing programs have vouchers, housing subsidies attached, and allow people access to maybe housing, but there may be a wait list. And so sometimes people sit on coordinated entry until something is available. The other piece that's important with coordinated entry is utilizing coordinated entry allows counties and the state to see where the need is so that funding can be allocated appropriately. So we really encourage folks to go through that coordinated entry process for both those reasons, because one thing is sometimes people don't get connected to housing right away. And so that first step just shows them we're moving forward, we're getting you connected to some housing. It may take a little while, but in the meantime, we'll continue to look for other options, but at least you're on these lists and prioritized to see where what you are eligible for. And then also making sure that our counties are getting the money that they need. And if people aren't utilizing that coordinated entry, it doesn't give us the same data to show the need in each county. So, you know, coordinated entry is really an important piece of the housing continuum. I know it can be sometimes challenging in different areas, but it's really important that we connect people to coordinated entry if they agree upon it. And it's something that you can do from the home, from reaching them out in homelessness, or if they're already housed and are unstably housed and need to be reconnected to new housing, that's another option as well.
Okay, so this is Amanda again, and I want to say thank you, Kimberly, for talking about coordinated entry. I feel like that's a really important piece that maybe some people aren't aware of that it exists. Coordinated entry is a really great way to get your participants connected, or people who are experiencing homelessness connected into those services. So, you know, we start with that outreach piece. We're meeting people where they're at. We're hanging out with them. We're getting to know them. And then maybe we have the ability to talk them into doing coordinated entry. And then that gives that piece where they're prioritized and moving forward. So after they're in this PATH or Peer Pathfinder program, and they've been inducted into the coordinated entry system, now we got to think about, gosh, what do they qualify for now? Like, what are the programs that are all available in Washington State? So we can't give you every single program in Washington State, but we can talk to you about our program. So you heard Wanda earlier. She is our original HARPS program manager, and HARPS is a fantastic program. Usually it's a really great precursor to super long-term and support for your participants. So, you know, Friends with HARPS is regular HARPS, my apologies, original, not regular, is housing and recovery through peer services. And it's a really fantastic opportunity to help your participants with that jump start that they might need, getting out of getting off the streets or out of tents or couch hopping or whatever that circumstance may be, but also for the piece that comes along with that I'm sorry, I'm trying not to use acronyms. So, you know, when people are shifting out of areas where they may need help, i.e. Maybe exiting inpatient settings, then there is a possibility, thank you, Melody, I could not get that out of my mouth to save my life. When they're exiting inpatient settings, HARPS is there to bring them in. And again, now we have forensic HARPS, which is a step in a different direction, but still very much the same. Forensic HARPS is part of the True Blood settlement, and the state is funding enhanced engagement to connect identified individuals with the service. So basically, this is going to help build relationships with individuals who are identified as most at risk of referral in the next 6 months for competency restoration. And it's what the settlement calls high utilizers. We try not to use that phrase too much though, because that sounds pretty cold, right? So if Forensic HARPS, they're currently working on expanding and blowing the lid off of all of the necessities to get into the program. But for now, there is specific necessities, and Nicole Mims is your gal. We also have the PATH and Peer Pathfinder, which I spoke about a little bit earlier, programs. And those are specifically homeless outreach programs, or short, and not only just that, but they also include short-term case management, basically, that goes with it, surrounding housing and anything that your participant needs. That would be including getting hooked up with Medicaid. They may not have it. They may not have known that they have the ability to have it because, you know, maybe not everybody stays up on top of government news. And that definitely happens. Or maybe they made more money at a job last year and lost their Social Security and never signed back up again. PATH is specifically, and Peer Pathfinder are specifically created to help participants with those very foundational needs to get them moving forward. And then forensic path, again, is part of the True Blood settlement. And it's all about funding that engagement to connect individuals to services. And they too have that very specific qualification. And then of course we have foundational community support, which is, I represent Eastern Washington, Kimberly represents Western Washington, and foundational community supports really does press really down hard on that magnifying glass on the social determinants of health. And so we want to make sure that in SCS that all of our housing and employment specialists are doing their very best to follow those guidelines we talked about earlier through the dimensions of permanent supportive housing. And let's see here. And then I'm sorry, I see a message in the message box. So forensic path is a combination of services and subsidies, as well as forensic harps. So foundational community supports really pays for the services, reimburses for services offered, but we are absolutely not a subsidy or ongoing rental payments. Kimberly, can you move to the next one? Okay, so this is the best map in the whole entire world if you're looking for services around housing. If you look at this map, we have this right here, housing and recovery through peer services. That's your HARPS team. There's one in every region now. There is, and go ahead. Oh, Kimberly, can you click the map? And maybe we can give them an example. Oh, look at that is great. So it's an interactive map. When you guys get the slide or when you get the set of these slides, you'll have the ability to look through that map. It's pretty fantastic. Excuse me. But it shows all of the ability, all the clubhouses, all of the Oxford houses, the HARPS teams, and the PATH teams. And so with the little legend on the bottom, you'll have the ability to say, well, gosh, I have this participant who is stuck in Thurston County, but they want to move to Kittitas. What do I have available? Or they're getting out of treatment here, but they don't want to live here. How do I help them out? Or just finding out what's available in your area. That's pretty important as well. Before we move too much further, I do want to explain about Oxford houses because it was on our map, but I don't think I covered it. So Oxford houses are increasingly important for individuals who really, really want that support with abstaining from drugs and alcohol. And it's really a fantastic experience for those people who choose to do it normally. It is a shared room occupancy situation. Normally individuals will share a bedroom with each other, like 2 people to a room. Sometimes it's 1 person to a room. I think it just depends on occupancy and how full they are. So there are over 300 Oxford houses across Washington State, and Melinda Trujillo is actually the program manager for that. We'll make sure that we add her email in. Washington State has the highest number of Oxford houses in the country. So right now, when I said we have over 300, it's not like 301, it's like 325, which is fantastic. That is 325 opportunities to help your participant with transitional housing. Okay, next one, please. And here is our SCS Tableau map, which I love. You have the ability at the top to select a service region or a county, and then the provider type. So are you looking for SE or SH, or are you looking for both? SE would be supported employment, SH, supportive housing, and a lot of our foundational community supports agencies actually encompass both. So that is great, a nice well-rounded opportunity for participants to get that additional help and support that they might need. Let's see, Kimberly, do you want to mess around a little bit with the map and show people how it works? Oh, maybe it won't let us. That's okay.
It's not allowing me to do anything on it. I apologize.
No, that's okay. But as you see there, it's the pull downs, making selections, and then going from there. we will make sure that we send this Tableau as well, or the ability to get to it, the link for it, through to your mail with the follow-up email after the webinar. Okay, so I just feel like I have never stopped talking ever. So I want to make sure that we talk about the process of housing being connected to stabilization or crisis, what we used to call the living room or crisis houses, and how do we get connected to the participants, and then as housing providers, and then how to get the participant enrolled in your housing program. All of this can be done through an early screening process and updated internal training on resources available to serve participants. So crisis stabilization and supportive housing. Gosh, this is like, if you aren't used to doing this level of connecting, it could be really difficult, right? So when do we do this? As soon as your participant is ready and they indicate that they are in need of housing and they're willing to participate, then it is time, as soon as they say so. So how do we do this? This can be difficult, creating those strong relationships internally as well as externally in order to support your participants. Take some time and some real effort. So, pardon me, guys. You know, it may be a real team effort here to make sure that you're able to support your participants. And then, of course, and like we kind of covered that earlier, any individual who is experiencing homelessness indicates that they are willing to participate in this program, and in this instance, in crisis stabilization. So Kimberly and I want to tell you a story or two about our experiences working as housing staff, doing direct service, as well as doing direct services, as well as excuse me, I'm losing my train of thought. Kimberly, can you take over, please?
Sure. So we wanted to talk a little bit about how this has been done at other agencies, and we actually have experience moving people from crisis stabilization into supportive housing. And so we wanted to talk a little bit about what that looked like. So in our experience with an agency, we actually had a crisis stabilization house connected to our agency. So for us, a lot of the connection initially was internal, right? We had to talk about what that process would look like, who would be involved, and really think about those pieces. And so what we would do is our crisis stabilization, because it was connected to our agency, it made it a little bit smoother. So they put processes in place to know that as soon as someone walked into the stabilization house or walked into the ER and one of our folks was helping support them, and they said that they were homeless or had needs for housing, then they would immediately start doing that connection piece. So what that means for what we did was they would send an email over or actually call us if they could get a hold of us. And most of the time it was done both. They'd send an email and then try to call us and get that individual connected with supportive housing so that we could come in to actually the stabilization, the crisis stabilization, and start assessing that individual for supportive housing before they were even thinking about being released, right? So a lot of places have that 14-day kind of cutoff, and they really want to get people connected to additional services before they have to leave. So getting people connected to that housing support right from the beginning is so important, because that allows us that period of time while they're still getting stable and getting connected to other services, that we can start working on that housing piece. So we go in, we meet with that individual at the stabilization house, sit down and really talk about what they want and need in housing. That requires, we'll do assessments, and I'll talk a little bit more about what supportive housing services looks like in a little bit. But we connect them to those resources that would allow them to move forward in that housing that they want. So it would allow us to start talking with them, set up times to maybe go get connected to a housing voucher, go through coordinated entry, and really start using that time while they're in stabilization to start working on those housing supports before they ever have to leave stabilization. This is also the time that we want to get people connected to those mental health resources, SUD resources, and all of those things that are going to be important for them to continue stabilizing and moving forward. So we'd start working with them as soon as they connected with us and try to spend that time doing that work. And then, of course, once they were released from stabilization and had to go out into housing, we would hopefully have them connected to some type of housing prior to them leaving, whether that's a shelter stay, whether that's transitional housing, or maybe we've already started working on that permanent supportive housing piece and finding a unit for them. And we'll continue to support those folks in those housing supports moving forward, all the while allowing that stabilization to kind of do that warm handoff that we're going to talk about in a minute and ensure that they're getting connected to those supports and then be able to kind of end the stabilization services, and supportive housing and mental health and SUD can kind of take over and wrap around services for that individual.
Thank you, Kimberly. I appreciate that. Can you tell me, just out of your own personal experience, are people who are in crisis stabilization, who are experiencing that crisis and in need of housing, is there any limitation in your experience with the amount of times that they can receive this help? Like if they go in and they come out and they go in and they come out because they're having a real struggle, are we going to go and meet with them every time if possible?
Yeah, so with supportive housing, we're really there to support them and ensure that they're doing well in their housing. Even if they go into crisis again and they have to go back into stabilization, we'll do what we can to support them and ensure that they don't lose whatever housing situation they're in. And so part of the supportive housing piece is to really make sure that we're being proactive and making sure those folks don't lose their housing even while they're going into crisis services. So that continual coordination between crisis and supportive housing is so important. And I'll kind of explain why. And this is, I had an individual who I had just housed out of stabilization, actually, and they were doing really well. And if we don't have good coordination, sometimes we lose that piece where we find out somebody isn't doing well again, right? And if we're not kind of keeping coordination. And so although I didn't notice, they had gone back into crisis and had opened a crisis episode at our agency again. And I wasn't notified and I didn't do my due diligence to follow up. It seemed like they had been doing well and we were doing our weekly visits, but I hadn't seen them in a couple weeks. I went and found out 2 weeks later that person had been detained and they were actually losing their housing because I hadn't kept in my good coordination and crisis hadn't coordinated with me to let me know that they were back in. And so, between the two, we kind of lost track of that and actually ended up having to really focus on getting that housing obtained again because they actually lost their housing. And if I had known ahead of time that was happening and really had done my due diligence with my care coordination and working with crisis on a regular basis more effectively, that probably would have been avoided. So that's just kind of a lesson learned that I found when working with folks.
Thank you for answering that question, Kimberly. I think it's super important for everybody listening to know that, sometimes that crisis piece and the housing piece isn't just in the beginning, but sometimes it's throughout services. And so thank you very much for elaborating on that. So let's talk a little bit about warm handoffs and what's a warm handoff? How does that work? So basically, internally, your warm handoffs are going to include, and when I say internally, I mean internal staff. So if you have more than just housing in your agency, but say you have behavioral health, there's therapy and medication management, maybe there's even a PACT team. And so the agency that Kimberly and I came from when we were doing direct service encompassed all of this. So we had the ability to reach out and actually what we called staffing time. So part of this is going to be regular check-ins. Do you have a weekly meeting? Is it one-on-one with just your boss? Or maybe it's team-based where housing and crisis services get together every Monday morning, because we know the weekends can be rough on our participants if we're not available to them, right? And so that's a big piece of it as well. Okay, so there we go. Assessments and or referral forms. I think we actually went out of order with those, but that's okay. We'll make it work. Assessments are basically a piece of paper that allows another person who's maybe doing service with you, like a therapist or crisis stabilization, to say, oh gosh, well, this assessment says they're looking for housing, or they absolutely are allergic to perfume, or there's a ton of different assessments that will give another person who's in service with your participant, as in giving services, an opportunity and that nice magnified glance without full engagement at that moment. Treatment plans. So we know that everybody on this call loves treatment plans and care plans. I can hear you all clapping and cheering in the background. But what these do is they define goals and outcomes. And so if there's a situation where you go from a PATH provider, a homeless outreach provider, and you're handing your participant gently off to their new housing person, that can be, having that goals and outcomes and talking to them about the personal piece of that service for your participant is going to be huge. The same can be said, especially with crisis services. When a participant is leaving a crisis stabilization, especially when they're leaving, they're probably going to feel a lot of heavy feelings. There's probably going to be joy, happiness, fear. It's going to spike anxiety. It's a really tough situation. And so making sure that we have the ability to walk in, introduce them, maybe have a couple of meetings with their new person that, that we're going to hand them gently off to, is probably for the best. Creates positive outcomes. It builds trust, and it's going to increase the possibility of higher attendance with their new therapist or their new housing specialist. So that warm handoff piece is a really big deal. Internally, other people in your agency, they might not even know what your program is. So our agency was so large that it took Kimberly and I a good 2 years of doing presentations internally and reminding other service providers that we existed outside of just case management, that we actually had multiple housing programs that we were a part of. And these are all the wonderful ways they can help your participants. So, educate your colleagues. Newsletters are great for that. All staff presentations. We used to have this really great meeting once a month where we would have a room in the office. And we know right now that's a little difficult, but Zoom is a beautiful thing. And we would be able to just talk about our program for anybody who came in. 1 year, Kimberly and I did a trick or treat where we had all of our housing staff, including our coordinated entry staff, anybody who touched housing basically, sat up like a little tiny neighborhood, had Halloween decorations up. It was fun. And you can get creative with this and still educate. So, and last but not least, absolutely not least, is leadership buy-in. You have to, your boss and your boss's boss and your boss's boss, they all have to agree that this is a good idea. If you don't have the backup, then that's going to be difficult. Next slide.
All right, thank you, Amanda. I want to talk a little bit about external coordination, because this is even sometimes a bigger challenge and doesn't have to be, but it does take some work to do. So that warm handoff, we're talking about making sure people are getting that warm handoff to these other support services, that be housing, mental health, SUD. We don't want to just say, hey, here you go, have a nice day, right? Those warm handoffs are so important. And with doing this externally and having these relationships externally does take a little bit of work. And so having that leadership buy-in we just talked about, that's so important. So really talking to leadership about how is this going to work with the agencies we work outside of our own agency? Who are we going to do this with, and identifying those folks and really talking to them about, what they're okay with and what the perimeters of these relationships and partnerships will be. Having those regular check-ins, that's not just for internal. When I was doing direct service, I spent a lot of time out in the community, spending time with our partners and building and maintaining those relationships. So having those regular check-ins, whether it's a meeting once a month where everyone gets together, or whether you do one-on-one meetings with the agencies you partner with, whether it be the housing program you're partnering with, whether it be a behavioral health agency, but we really want to make sure we have regular check-ins to do that coordination of care and that staffing, right? To talk about what's working in this process, in this partnership, and what maybe we need to improve upon, and really talking about that. Having those referral forms, especially with external referrals, and that warm handoff is going to be really important, right? We know that sometimes referral processes do not go very smoothly, and part of that is because warm handoff isn't happening. Because really, you can send a referral form somewhere and never follow up to see if it ended up anywhere, or if the participant ever got connected, and sometimes people fall through the cracks during that period of time. So we really want to make sure we have a consistent referral process and really good referral forms that we can use across agencies in order to make that referral process and warm handoff much smoother. And it also gives us a paper trail, right? It gives us that documentation that we need. MOUs and releases and disclosures are going to be really important in these partnerships, right? We may have to create an MOU with your housing agency to talk about how that would look to have them come in to your agency and work with people while they're in crisis. So a lot of times, there needs to be an agreement. What would that look like? What are the perimeters around that? And how do we agree to this between agencies? How are we going to share, documentation, and all of those kinds of things is really important. So just so you know, if you ever need help or have questions about how to do these MOUs and releases and disclosures, this is something that we can certainly support you in and helping you move forward and what works best for your agency and how that works. It's also really important to define the goals and desires of what outcomes you're trying to reach. So, we're really looking on getting people connected to that housing and those other supports coming out of crisis. And so we really want to make sure that we're defining what that looks like and what we hope the outcomes will be, and ensure that we're really following up with each other to see how things are going and whether those outcomes are happening or not. And if not, how can we improve that process to make sure we're getting there? Again, make your presence known. One of the things I learned in direct service, especially working in a rural area where, not everyone was open to all the ideas that were going around, is making your presence known and being tenacious. And I don't mean tenacious in a bad way, but just, making sure that people understand that you're out there and this is what you have to offer, and that we're all in it for the same purpose, to ensure that our individuals are getting served well and getting housed and getting connected to those other services that are so important for them to be successful and move forward in their recovery. And so we really want to, make sure our partners know about us. One of the ways to do that is attend homeless task force meetings or stakeholder meetings in your community and say, hey, this is what we do. This is how we want to do it. We're going to be, we want to get people connected to these services. Let's create some partnerships and make it happen. And sometimes it's going back again and again and just saying, hey, remember we talked about that? Are you still interested? And knowing who to go to at certain agencies is really important as well, to make sure you're getting the right buy-in from folks and getting that started. So sometimes, direct service providers only have access to other direct service providers, and that we're not always the ones to make those big decisions about how partnerships will happen and all of that. So we really have to have those conversations with our leadership and our agency to make sure we're all in the same goal, and that these are who we want as partners, and we're going to go make it happen. And that's the hard work, right, is going out and making that happen. And then educating and marketing, that's the same as Amanda said for internal. You have to do that externally even more so, because resources are coming and going all the time. And so making sure that we're educating and marketing about the programs we have and the processes that we want to provide, so that we can have smooth handoff and get people connected to those services that are so important to keep them in their community and not in crisis. So I think, you know, we want to talk about some examples of positive coordination and maybe some examples of negative coordination in your agency. If you've ever had experience working with internal or external, there's always the good and the bad, right? And so we'd love for you guys to use the chat box to share some examples, just so that we can, you know, so we know what's going on out there, right? So we can hear that other people are still having these, and if you are having challenges with internal or external coordination, we can certainly assist with that as well and help you kind of work through some of those barriers that may be happening. So we'd love to hear some of those examples as we move forward with the webinar, but please share that positive and negative coordination, because it does happen. And I think I gave some examples of that care coordination piece and just working with a different entity. Sometimes we lose people, right, if we're not being diligent about making sure we're doing that follow through and that follow up. So it's really important on both sides of the coin that we're thinking about that and talking with each other about how important that is in the process of connecting people to other services.
So Kimberly, you gave a really great example earlier of some negative coordination, and I really appreciate, and I'm sure everybody else does, that you were that you know, you owned your part of the responsibility on that, because you know, coordination is a dance, right? We're all working really hard to make sure that we're not stepping on each other's toes, but we're still achieving what we're looking for. And so I wanted to give you guys an example of positive coordination while you're typing, hopefully typing into the question/chat box about a positive or negative experience you've had internally or externally with coordinating, you know, in order to achieve that warm handoff piece. So I had this really fantastic experience, specifically around coordination with crisis stabilization when I was in direct service. I had a participant who was really, really struggling, and she hadn't let me come and see her for a while. We were doing active home visits once a week. I was calling, I was reaching out, I was talking to her therapist at my agency. I was doing everything I possibly could, but I didn't feel like I was making a difference. And when she ended up being brought into crisis stabilization in order to help with these challenges and these obstacles that she was experiencing, I instantly got a phone call because she, you know, because they knew that I worked with her. We had this great relationship with crisis stabilization, and they always, I mean, to the point where they kept our housing forms at the building so that we were ready to go. So that was, so, you know, that is what we consider most certainly an example of positive coordination, at least internally. So, okay, let's talk a little bit about resources and partnerships in your community. So while I'm talking about this, it would be really fantastic if you could throw in a couple of resources and partnerships that you have in your personal community, because we know that everybody on this call is from all over the state. So the first thing is, if you're not already a behavioral health agency, and even if you are, having that coordination piece and partnership with other behavioral health agencies in your area is going to be key and elemental. And the reason for that is because, you know, not everybody's going to want to have services at your agency. So even if you do encompass all of those levels of help and support, they may decide that they want to go to a different agency because they have a trust with other people there. Also, SUD and MAT agencies, and SUD is substance use disorder, and MAT is medically assisted treatment agencies or medication assistance. So depending on who you're talking to. And so having that as well, especially if your participant struggles with substance use. If that's part of their behavioral health, then having that connection is huge. Community action. One of the best partnerships that Kimberly and I ever had through all of our direct service experience was community action. We had a really great relationship with them. They helped our participants. There were times when they even helped us with coordinated entry. because they were a coordinated entry site. So Community Action has a lot of programs available to help with housing, rapid rehousing, long-term housing, long-term transitional housing. And so all of those, for the most part, come with the necessity of some kind of case management. And this is where you can really build up that personal relationship with them by, by dueling. They take care of one piece of it, you take care of the other. And having a relationship with them is really beneficial because sometimes they'll let you know when they have new grants that you don't know about. And as well, the housing authority, just as important. Being able to find that brick and mortar for your participant, or at least that lowered amount of money for a voucher possibly, is really, really important. DSHS. 9 times out of 10, the participants that I served had a DSHS worker to help with TANF benefits or SNAP benefits, which are TANF is temporary aid for needy families, and SNAP is, I apologize, I don't know the name for SNAP, but it's basically food. Excuse me. Okay, and then of course, especially last but definitely not least, are your community shelters and drop-in centers, your warming stations, places. Kimberly and I did a fidelity review recently, and there is a couple in this specific rural area who actually are not affiliated with any agency, but they have a soup kitchen every single day. And so the staff knows that they can go there and possibly find their participants eating dinner every night or lunch if they otherwise can't get a hold of them. So those partnerships are huge. And please remember that, disclosure rules, HIPAA rules, and following your policies and procedures for your agency in order to reach out and have that experience. Kimberly.
Yeah, a couple other resources I wanted to make sure that we talked about was the Washington Connection and the Volunteer Sisters. It's training people how to connect people to Medicaid. So if you have an individual that's maybe not on Medicaid and they need that Medicaid connection to be able to get their benefits, maybe get connected to a housing program and their mental health services, we really want to make sure that we are connecting people to that Medicaid piece. So that's really a really good resource, and we'll make sure that some of these resources are put in the follow-up email so that you guys have them and know how to connect to them. Another one is SOAR. SOAR is an expedited process for folks experiencing homelessness and that have mental health challenges. So one of the things that we can get you connected to Wanda Johns, who is really familiar with the SOAR program, and you can get trained on how to do SOAR. It's a really awesome expedited process for individuals that are eligible, and we really would love to actually provide a webinar on that down the road so more people can get familiar with it. But if you're interested in knowing what that looks like for that Social Security process, let us know. 211 is also another great resource. You call up 211 or get on 211 online, and it connects you to an amazing amount of resources for your area and your community. And so I think that's another great resource. If you have questions about other community resources and things that would help you get people connected to those things to really get them moving forward as you're working with folks, please reach out. We have tons of different resources. We may not be covering them all in today's webinar, but want to make sure you guys get connected to them. So let's talk about how we actually create and maintain these relationships. So we've talked a little bit about why they're important, kind of how to do them internally and externally, but how do you get them going and maintain these relationships? And that's kind of a hard piece at times because, you have these big ideas, you know what you want to do, but you can't always make them happen, right? So you have to get other people on board and figure out what it's going to look like to be able to move forward with building these partnerships and really working on getting them established and have a foundation for how it's going to work. So again, we talked about creating buy-in. This could be not only with your leadership, but the other partners that are going to be involved, and really talk about why we've chosen to do this, why it's important for our agency to get involved, why it's important for us to have, these partnerships with the housing agencies or the CAP agencies or the SUD agencies. It's really important to talk about that and what our goal is. And then we need to decide what level of partnership you want to create with somebody. So that could be something as just as a referral. We want to refer them to your housing program, right? And make sure that they get connected to supportive housing services. We want to get them connected to mental health services and make sure that they are getting that warm handoff to make sure that there's no gaps for folks, that these folks really are connected to services before they leave stabilization. Or, we want to have this huge partnership. Sometimes it's like we want to offer case management services for an agency that has, with the housing authority that offers subsidies, but they don't do case management. So really looking at what level of partnership do you want with an agency and talk about that. And then identify potential partners. So Amanda we have talked earlier about some of the partners in our community, whether that be the behavioral health agency, a supportive housing partner, maybe it's an employment agency, SUD, whatever it is, and maybe it's all of the above really, and figuring out how and who we want to have these partnerships with. So identifying who that is and what's important about that partnership. And then reaching out. So I think earlier I had mentioned that you don't always know exactly who to talk to about building these partnerships. And one of the things I hear a lot is, well, we tried to, but it never went anywhere. I reached out to, a behavioral health agency and wanted to really get that good coordination of care, but, nothing ever came of it. It went to somebody else and then it just kind of stopped. And so finding out who would be the best person to engage with at that partner level so that we know that we're getting people that can make these decisions, right? Because we're not always the ones that can make the decisions. So maybe it's having our supervisor, our leadership reach out to their leadership, however that looks like, and you guys have to figure that out. But it's really important that we reach out to the right people so that we're getting those partnerships moving forward. Otherwise, sometimes it ends up in an email. And so, setting up meetings to talk about it, introducing each other, orienting each other with what we do at our agencies is really important, and talking about how that partnership can really work and the outcomes you hope to gain from that. You can also find other organizations who are already involved. Maybe there's organizations that already have partnerships and you just want to kind of add into that and say, hey, we want to be part of this. How can we make this work so all of us can be involved? And of course, defining those goals and outcomes. And then don't overcomplicate things. So one of the things I find that we do as agencies is get in our own ways. We put up barriers that make it more difficult for referral processes. So really trying to keep these partnerships simple so that they're easy to maintain and they make sense to everyone. And it's not hard to figure out who does what and what the process is to get someone connected and all of those things. You don't want to overcomplicate things. So really figuring out the best way to do it in a simplified manner so that you guys can have these great partnerships and it doesn't make it so that people don't want to work with them, right? So there's sometimes when things just get overcomplicated and you're like, it's just been too much, too hard to keep this maintained. It's not working out because there's just too much going on. And then relationships in your community are really important because they build that community. So we talk about that silo effect all the time and people falling through the gaps because, they're having to go here and go here and go there. And sometimes that's not the best resource for them, or it doesn't work because there was no warm handoff and follow-up to see if they ever got connected. So this relationship building creates that community of support between agencies and really allows that kind of well-oiled machine for people to receive services and not lose folks in the process of that. And we don't want folks to get connected to a housing program through crisis stabilization and then never find out if they ever got housing or ever got connected to services or ever got that support. So really ensuring that we do those check-ins, those community meetings are important, and just that really builds the community that we have in order to support our folks, because it does take a village to house somebody. And I say that because we can't just do it all ourselves. You guys, it takes all of us to work with someone and support them in order for them to be successful. So that's how we build that community.
Kimberly is absolutely the mecca when it comes to coordinating in your community. In fact, Kimberly taught me a lot about community coordination. And and how sometimes, you know, you have to be patient in order for people to get a hold of you. Because I have a tendency, or did especially at the time, to be really impatient. I wanted to get in there and get it done. But it doesn't matter. She's right. It doesn't matter if you're in a large community or a small community, metropolitan or rural. It doesn't matter. Absolutely, you are part of your community, personally as well as professionally. And so it takes all of us to build it up. So all of this really comes down to advocacy, right? Because we know that we're definitely in the housing and behavioral health business for the money. I'll wait to hear the collective chuckles. Okay, so, pardon me. So why do we do this? Why do we advocate for our participants, or for anybody for that matter? I mean, you know, what kind of outcome do we get through advocacy? So you can read up here. So I'm not going to read through the list, but I'm going to elaborate a little bit on each of these. Lowering stigma is a giant piece of the work that we do right now. It's very encompassing, and it's incredibly important in order to assure that we're going to have what we need for our participants, including housing, non-biased housing to boot, employment services, all of these services. And sometimes stigma, it creates those giant barriers, right? And they can be created internally in your agency as well. So that's why we really push for that recovery language, holding the hope, trying to stay positive as much as possible, which we know can be difficult, especially in this climate. Participant advocacy gives you a voice, it gives your participant a voice, and sometimes it gives people around them the idea, that rightfully so, that your participant is worthy of having their own voice. And so that it also gives strength to their choices and their voice. And the reason why we want to do that is because we are housing first. And we believe that when people make decisions, they absolutely know what is best and what is not best for them, better than any of us ever possibly could. Advocating helps individuals feel like they can make these decisions on their own, or empowered enough to make those decisions. Promotes growth. I'm a peer. I utilize services for 2 years, and I can advocate up and down one side and the other for my participants, or anybody really, but I struggle advocating for myself. So having somebody to support me through that for a while was really important. In fact, I think that mostly everybody has somebody who advocates for them once in a while as needed. So building relationships is huge. We know that relationships in your community, as Kimberly mentioned, is a big part of your service package. It's going to be huge. We can't do everything for everyone all of the time, right? And so being able to handle that piece, being able to do those warm handoffs within your community, to have that collaboration is huge, but it also builds trust, not just for you and maybe that collaboration, but with your participant as well. Because if your participant's seeing that you are working on that trust piece, and you're working with this person and you like them and they're fine and they're considerate and they get the job done, then that's automatically a bridge that wasn't there to begin with. And then finally, advocacy creates new opportunities. It absolutely does. So, maybe your participant says, I don't want to live there. That's a set aside. That's for people with disabilities. And I don't want to live in a place for people with disabilities. I want to live in a regular place that I feel regular in. And those are things that, that you hear a lot. Like people don't want to always be put in set aside. They don't always want to take what they view as the easier path. And so advocating for your participants' needs and their wants in those situations really does create tons of opportunities. It can create job opportunities. It can create educational opportunities. And it also creates that wonderful informal support that we're all absolutely hoping that they can build. And we can help them with as needed. Kimberly, do you have anything you want to add to this? Oh, okay.
Nope, I think you did a great job. Thank you.
Okay, no problem. So just a handful of pre-tenancy services that are available through foundational community support, because, after your participant has moved out of moved away from the homeless outreach piece and they've been shifted through coordinated entry, and you're doing those warm handoffs to maybe HARP. Maybe HARP is going to do a warm handoff to foundational community support, or forensic HARP to me. So there's a lot of possibilities in this. This is the list, a very generalized list of all of the things that you can, all the services that you can bill for just pre-tenancy. You know, and landlord liaison, it includes a lot. Talking to landlords, finding landlords, looking for housing, that direct service piece. It doesn't always have to be, it can be on behalf of your participants. So as you see in there, we've discussed most of this. You know, assessments are important, that coordination piece, those community supports, long-term and short-term goals through care planning, yay, treatment plans. And then of course that financial skill building and the benefit support. So all of that really encompasses, you know, stuff that you're probably already doing with your participants, but SCS assures that you get reimbursed for it. And Kimberly.
Yeah, and in some level, you know, most housing programs are going to do some level of this work with folks. And so we just wanted to also give you an idea of the fact that when you're getting someone connected to supportive housing, whether it be HARPs, foundational community supports, and a lot of other programs out there, this is the kind of things that we're going to be starting to work with folks on and really get them moving forward to connect to those other pieces of services, and also making sure that they're moving forward in their housing supports and getting them to those goals of finding and maintaining housing. So one of the last things we wanted to talk about is, you know, these relationships. You guys have done this. You now have established these great partnerships with your supportive housing agency, your behavioral health agency. Maybe that's the same agency in some cases, but you're out building these great partnerships to make sure that when folks are leaving crisis stabilization, they're being connected to supportive housing. They're being connected to the mental health piece, right? And so those warm handoffs are really important. Those relationships don't just keep going, though. They don't just happen, and you just make the partnerships happen, and then you don't have to do anything else, right? I put up this slide, and I think we wanted to make this really important, is because you have to maintain those relationships. And don't we all just love the Golden Girls? I wanted a soundbite here because I love the song. But the point is to really, you know, just like any other relationship you have in your life, you need to maintain those relationships, right? You can't just say, okay, we're friends now, and then just never talk to each other again or check in and see how they're doing, right? We have to make sure that things are going well. How are you doing? How are you feeling about this? Is there anything I can do to support you? These are some things you can do to support me. This is really important, right? It's really important for the partnerships you build. It's important for that handoff to make sure you maintain that until you know your folks are supported, to be sure that, you know, it's okay to say, okay, we're going to, you know, we don't need to continue to work on crisis stuff. You're doing well. You know, we're going to hand you over, and now you'll be working with just your supportive housing program, but making sure that those things are actually happening before you walk away, right? And then checking in and making sure that those relationships that create that ability to do warm handoff is equally being maintained, and that we're checking in with our partners to say, hey, how are we doing? These are some things we need support in, and really talking about that on a regular basis, because otherwise they kind of go away. Things start going bad, and we start losing those relationships and those partnerships, right? And then things kind of get really fall through. Then our participants are the ones that suffer from it. So we really want to make sure that we not only emphasize that partnerships are important, but you have to continue to maintain those. And whether that be picking someone to attend those meetings that's in your team, or having people take turns, it's, you know, important that everyone's face is known, so people go, oh yeah, you work for Frontier, or you work for, you know, wherever, and we recognize you. And so, you know, we work with this person, and we have a great relationship with these people, and we, you know, we see them around working with our people, and it goes really well. And so we really want to just emphasize how important that piece is as well. All right. So we're going to leave the next 5 minutes or so for questions and answers. And Nicole, I'm going to hand it over to you.
Awesome. Thank you so much, Amanda and Kimberly. I really appreciate all of that information. I'm sure some of you on the phone probably feel very overwhelmed with the amount of information that you just received in the last almost 90 minutes. So we do want to give a few minutes for question and answer, but I do want to give an update on the contract amendments that I am working on. They, to the best of my ability, I believe that they will be ready to distribute to your agencies most likely by the end of this week. They're in the very final stages of the review process, and we have incorporated the additional funding that we had talked about to allow each of your agencies to have a little bit more money to serve people, anybody and everybody that comes through the crisis stage facility who is experiencing homelessness. And so there's some extra money in those contracts, as well as the eligibility to serve the broader population. And Melody has given the green light to all of your agencies to start that expanded eligibility to anybody and everybody that's experiencing homelessness. Effective right now, today, can utilize a short-term housing voucher. And the only other thing I would like to add to that is just to make sure that just as our process was before, you're still going to want to capture every piece of information on that tracker, so that we have the information of who's being served, how much funding was spent on each individual person, where they went. And then I know that the tracker doesn't specifically talk about other programs that you're connecting people to, but I do know there is a comment section on the tracker. So if you could just identify what program you made a referral to and who you connected the individual to in the community on that tracker, that would also be really great information for us to have. Any questions?
Hey, Nicole, this is Amanda. There was a question in the chat box about helping with people coming out of or being discharged from an ENT. One of the barriers that this individual mentioned was cell phones. Are there any resources to anybody is familiar with for cell phones for the people that we serve? I did respond to that and let them know that if they emailed me, I would send them links. But I want everybody to know that we had a moment for a while last year where we were able to hand out cell phones through donation process. And unfortunately, that's not the situation anymore. But we are moving forward with getting cell phones to be part of the supportive housing piece with foundational community supports as a Medicaid benefit. So we also have a one-page, kind of like a one-page resource that we can send as well about how to get help with cell phones, including all of the,
awesome.
the way to apply for the free ones as well.
Great. Thank you so much. I do also want to offer, if there is anyone who is interested in having a specific program, do either a meet and greet or introduction, we are more than happy to work with you to connect you to the various programs in your community. Might be traditional HARPs or the Path Outreach Program or the Peer Pathfinder Program. You can email me at any time, not only with that request, but with any questions you have about the process or what the expectations are or anything of the sort. I'm happy to help.
I don't see any more questions that haven't been mostly answered, I guess, in the chat box. So seeing that it's 10:30, Nicole, do we want to say goodbye and honor everybody's time?
Absolutely. Thank you so much, Joelle, and have a great day.
Thank you, everybody.
Thanks, everyone.